Imagine feeling like slowly over time your vision is just getting blurry. It's like looking through a foggy window. This can be frustrating and disorienting. And the reality is, it affects millions of people. We're talking about cataracts. But what if I told you you could see clearly with just one procedure? That's the promise of cataract surgery. But here's the big question. Are the results permanent after cataract surgery? Today, we're going to be covering the ins and outs of cataract surgery, and particularly discussing whether the results are long-lasting. Cataracts are a natural part of aging. The lens inside your eye becomes cloudy, leading to blurry vision. So the goal of cataract surgery is to remove that cloudy lens and replace it with a clear artificial one. This is typically a quick procedure with minimal downtime, and it's known for restoring vision. But what happens after cataract surgery? Are the results long-lasting, or are there other procedures down the line that have to be done? Most people experience significant visual improvements shortly after the surgery. You'll typically notice clearer vision within a few days as your eye heals. However, it is important to understand that while the lens that we put inside the eye after cataract surgery is permanent, there are some post-surgical changes that can occur. Specifically, there are tiny little cells of the original cataract that can be left behind. You simply can't see them during cataract surgery. In patients, these tiny little cells can sometimes migrate to the back of the new lens that was put in and form an opacification called a posterior capsular opacification, or PCO for short. Now, this is sometimes referred to as a secondary cataract or even scar tissue. And if you experience this, the solution for this is relatively straightforward. We do a procedure called a YAG capsulotomy, where we essentially use a laser to break apart the scar tissue, thereby restoring your vision to what it was right after the cataract surgery. Now, unlike cataract surgery, which is intraocular surgery, the laser is not surgery. It's a straightforward procedure, and we use this laser with you sitting upright with a dilated eye and essentially break apart the scar tissue. The YAG laser clears up the cloudiness in just a few minutes, and it is painless. Most patients feel little to no discomfort. So if you've had cataract surgery or are considering it, realize that cataract surgery is a permanent procedure. When we take your cataract out, the new lens that we put in is going to be with you for the rest of your life. Now, you may experience this posterior capsular opacification, or also known as a secondary cataract or scar tissue, but if that happens, the solution to this is really straightforward. Thank you so much for watching. My name is Dr. Jovi Boparai. I'm a cataract surgeon by training, and I love sharing information about cataract surgery so that my patients feel empowered and informed. If you enjoyed this video, you're probably going to enjoy these other videos down here. Take care of your eyes, and we'll see you next time.